Medical Superintendent of Lautoka Hospital, the Manager Nursing, Lautoka Hospital, consultants, head of departments, nursing staff, colleagues, and of course our guest from Australia, Mr. Elias. I'm indeed privileged to be here to launch another chapter of service delivery improvement in Lautoka Hospital. First and foremost, I wish to acknowledge the initiatives and the kind thoughts of our fellow men residing in Australia for the donation of dialysis equipments that we've just received. Mr. Elias, for your concerns for the health of the people of Fiji. As Fiji embraces the concept of wellness in the prevention of NCDs, we must not forget that there are already hundreds of patients out there already acquiring the complications of NCDs such as IHD, ischemic heart disease, stroke, eye complications, and of course, renal failures, and the list goes on. Managing and treating these complications is a crisis on its own, with demand on resources such as skilled and knowledgeable personnel, equipments, drugs and consumables, and bed availabilities for inpatients' care. We therefore thank the Rotaries for their understanding of the Fiji situation and actioning the need to have dialysis machines in Lautoka Hospital to alleviate the sufferings of our patients with renal failures. I have been told that there are 5 machines already in place, and utilization of the machines will be in phases to assist the hospital in establishing and developing the dialysis services successfully. The initial stage, as we have just witnessed, today is the formal presentation of the kind donations and launching of the dialysis service. Then comes the training for our staff, nurses, doctors, and technicians in the specialized area of service. I've been advised that there will be 2 machines to be activated, one for the intensive care unit for our inpatients with acute renal complications, and the machine can play a crucial role in reversing the disease course, and the other one for our friends visiting our shores who may wish to connect to a dialysis machine while enjoying the Fijian hospitality. Colleagues and friends, procuring, setting, and maintaining dialysis machines is not an easy task and can be very challenging with the cost implications. I thank the team for the understanding and have been informed that the machines that we have just received have come with a 6-month supply of consumables. The Ministry, in its drive for providing better health services, have been providing financial assistance to some of our patients with renal failures after it signed a MOU with Kidney Foundation of Suva early in the year, and most recently, just a few days ago, also signed an MOA with Sands Medical Clinic of Nandi. The assistance is targeted for those willing to step up to have renal transplant. Provision of 3 months dialysis can be assisted by the Ministry of Health. To conclude, I wish to remind our hospital staff, the ball is now in our court to take ownership of these machines, set standards and proper, well-articulated guidelines, processes, and protocols to make sure that our patients receive the maximum benefit from these hemodialysis machines. On that note, I wish again to acknowledge the Beecroft Rotaries and the counterpart in Sydney, led by Mr. Elias Yazin and his crew, for the kind thoughts in these initiatives. And I've been told as well that they are partnering with Royal North Shore Hospital for training and exchange program for our staff to get the dialysis service in Lautoka more robust and up to international standards. I wish the Rotaries wellness as they continue to provide assistance and support to this much needed service. May the God Almighty continue to shower His blessings upon us all. Thank you.